Hi everyone, welcome to my guide on understanding croup. I'm Dr. Venk, emergency physician, husband, and father to 3 young boys. And today I'm going to break down what croup is, what to look out for, including sharing some real sounds and video related to croup, how you can help your little one feel better if they have it, and stick around to the end to hear about some things that can look like croup but are actually quite different and sometimes even dangerous. Also, at the end, I will share a downloadable document that will summarize what croup is and help you prepare your thoughts and notes related to going to an emergency department or seeing a pediatrician for possible croup. So first things first, croup is a common childhood illness, generally affecting 3% of kids each year. Typically, we're talking about kids between the ages of 6 months and 3 years of age. And the condition is usually caused by a virus, most often the parainfluenza viruses. But there are so many potential bugs that can trigger this condition. It's basically when there is swelling in the upper airway or windpipe, and this leads to a distinctive barking cough. Upcoming, I'm going to share an example of this croup bark. Thank you to my colleague, Dr. Megan Kane, who is the head of pediatric emergency medicine at Mayo Clinic in Rochester, Minnesota. She provided this video, and I will highlight that she's provided some other media that I'm going to share as the video unfolds. People often call it a seal bark, but to me, I'm always reminded of that scene in Jurassic Park where the velociraptors are barking inside the kitchen. The other sound you may hear is a high-pitched sound or rasp when your child is breathing in. This is called stridor. It can be easy to think that your child is wheezing, but this is actually different. Dr. Kane has provided me a sound clip that I'm going to share with you. In the clip, you're going to hear a child crying. In between the cries, when the child takes a breath in, you're going to hear a raspy, loud, irritated sound. And that is the sound of air moving through a narrow neck passage. And that we call stridor. Were you able to hear it? Stridor is a more serious sound, and you should bring your child to an emergency department to get evaluated if you think that you are hearing stridor. Another concerning thing you may see is a child who is working so hard to breathe that they need to use the small muscles between the ribs or in the neck or even in their belly or abdomen to help them breathe. Here's a video, again, thank you to Dr. Kane for this amazing video, used with permission from the family, as are the other videos. These are also signs that your child should probably be evaluated by a health professional in the emergency department. Croup generally lasts 3 to 4 nights before becoming much better. Keep in mind, croup is the inflammation of the neck, but the same virus that's causing this or same infection causing this can cause other symptoms, such as rashes, vomiting, runny noses, sore throat, so many other things. People often wonder if croup is the same as asthma. Croup is different. Asthma is a lifelong condition that will get worse at times and be better at others. Asthma affects the lungs lower down, as opposed to croup, which is a problem of inflammation of the windpipe. Asthma often will be treated with albuterol and other medications that open the small spaces in the lungs. But croup does not get much better with albuterol. Having croup, especially a lot of separate episodes of croup, does increase the chance that your child will be diagnosed with asthma later in life, though it's important to keep in mind that asthma and croup are different. A lot of families have told me that they find steamy bathrooms, humidified air, or cool wintry air to be helpful for their child when they have croup. Some people have suggested that the steam might break up any mucus or secretions that are lodged in your child's airway. That cold air, other people believe, might soothe the windpipe when it's irritated. They are certainly worth trying. Really not going to be very harmful, just as long as you're careful not to let hot water vapor or hot water itself touch your child when you're trying to get the steam. There are not many high-quality research studies to show evidence for these practices, though. There is one randomized controlled trial that I want to highlight, which had about 120 kids overall. 60 of those kids received 30 minutes of outdoor cold air. By cold, I mean under 10 degrees Celsius or 50 degrees Fahrenheit. And the other 60 kids were randomized to receive indoor air that was warmer. What did they find? Well, they found the kids who got the colder air had their symptoms improve faster and better than those who had the indoor air. Both groups got steroids and other emergency department treatments. In addition, they found that the kids who had the more severe croup had the biggest benefit from the colder air. So, what do you take from that? Well, I think you just emphasize that there's really little harm to trying it, and it might actually help. Also, let's talk about humidified air. There was a randomized controlled trial in JAMA in 2006, and it covered this particular issue. They randomized children to getting 100% humidified air, so really humid air, 40% humidified air, pretty humid air, and then blow-by air, which is just the standard. And they did not find much difference in the three groups, really nothing to write home about. Does that mean you shouldn't try it? Absolutely not. It's pretty simple. If it helps you or makes your child feel better, even just the act of doing something might tell your child that everything is going to be okay, and they might get calm and feel better. So I would encourage you to try them if you're up to it and your child can take it. If not, come right to the ER and we'll see you. Speaking of staying calm, let's talk about that. Trying to calm your distressed child helps a lot. When the windpipe is inflamed, your child is feeling like they're breathing through a straw. If they get excited, scared, start to cry, their air needs are going to be higher, so they're going to breathe faster. And when they breathe faster but they can't get much in because it's so tight, well, they're going to feel more scared, and that makes them breathe even faster, and this cycle gets worse. So anything you can do to calm the situation and calm them down can reduce how fast they breathe and help them feel a lot better because they're less worried they're not going to be able to breathe. If your child is sick with croup or having breathing difficulty, if there's time to do so, consider recording a video of what you're seeing. Ideally, lift the shirt so the doctor or a nurse practitioner or PA can see what the child's chest muscles are doing, what their neck muscles are doing, what their belly is doing while they're breathing. And try and get the best audio you can to be able to share that stridor sound if you think you're hearing it, and hear a cough or two so that they can help make the best diagnosis when they see your child as possible. Also, it will help you to not worry that they're not seeing what you see if things get better, which often happens when your child is being brought to the emergency department. Certainly, if you don't think that there's time or it's safe to do that, don't do it. Just go straight in. In the emergency department, you might hear about treatments like dexamethasone or prednisone. These are both steroids that can help reduce the swelling that your child is experiencing pretty quickly. Usually a single dose of dexamethasone is all it will take to help your little one breathe easier. Dexamethasone, or the brand name Decadron, can be given by mouth or as a shot. This form of steroids typically begins to show effect at around 3 hours after it's given and lasts for up to 3 days in your child's system. So oftentimes, since we talked about how croup lasts only about 3 to 4 nights, so oftentimes one dose is all you need. That means you don't have to redose your child at home, which is a huge win for you and a huge win for your child. Some children may have symptoms that are so severe that they may receive a medication called racemic epinephrine. Racemic epinephrine is different than albuterol, even though it's breathed in through a nebulizer machine, just like albuterol would be. Albuterol is given for asthma. Racemic epinephrine isn't really given for asthma very often. Racemic epinephrine, some ERs may call this RAC epi, can help improve your child's symptoms pretty quickly, usually lasting for about 1 to 2 hours after it starts to help. So after this time, if it lasts for 1 to 2 hours and the steroids haven't kicked in, because it can take about 3 hours for them to kick in, there's a small window in which your child might get worse after receiving RAC epi, or at least return back to the way they were. It's for this reason that some places may ask you and your child to stick around in the ER even after things look so well. Your child might be feeling well and you might be wanting to get home. It's because they might worry that your child is going to get worse and they want to be able to intervene if that happens. Other places may have a model where you leave and then you come back at a scheduled time 2 hours from there to get rechecked. And yet a third model is that you go home and that if you are worried, they will have you come back at that 1 to 2 hour mark to get more treatment. All three models can work. It really depends on the healthcare environment that you're in and your expertise and ability to watch your child as well. Sometimes croup can be mistaken for other conditions that might be a bit more serious. The most serious one I can think of is called epiglottitis. This is a severe infection of a small part of the throat called the epiglottis. It sits back in here. It's become pretty rare these days after kids started receiving a vaccine against bacteria called Haemophilus influenza. This was around 1985 when this started happening, and the rate of epiglottitis has dropped considerably. With that said, if your child is not vaccinated, you should be thinking that this could be going on rather than assuming something is croup. Both conditions can have a voice change and it can be a cause of difficulty breathing. Epiglottitis can be fatal, and so it is truly a medical emergency, and I would encourage you to get your child seen, especially if they're not vaccinated. Another similar disease that causes a severe condition is called bacterial tracheitis. This is where there's a bacterial infection of the windpipe or trachea. It's not just inflammation from a virus. Both can create similar noises, similar breathing sounds, but kids with tracheitis typically look a lot more sick than kids with croup. And then finally, there are non-infections. Like if your child were to have had a coin or toy that they inhale, or any other kind of object they inhale into their windpipe, that can obstruct the airway in such a way that it creates a sound that's very similar to what you're hearing with croup. But keep in mind, this object is not likely to give your child a runny nose, a fever, a sore throat, and so those are going to be things that might help distinguish the two for your doctor or pediatrician. So these are a few of the conditions that doctors should be taking a look at to try and rule out before making the diagnosis of croup. Croup is really something that on history and physical exam, most people are going to be able to make that diagnosis, and you don't often need a chest x-ray or any kind of imaging. So that's the scoop on croup. I hope this helps you be a more confident parent taking care of your sick child and helps you distinguish some of the key findings that should definitely prompt you to get your child seen in an emergency department. In addition, my overall goal is that this helps you ask better questions and understand more of what's happening to your child if they're getting seen. Okay, I'm going to put up a link, a QR code where you can scan it and download a handout that helps summarize all this information, as well as allows you to take some notes and share that when you go to the emergency department. I hope this helps make the experience of being in the emergency department or your pediatrician's office a lot more rewarding for you and easier for your doctor to be able to help you. If you have any questions, please reach out. And as always, remember, smart health for smarter living.